Thanks, Jackie, and I hope people can hear me. Paul will just let me share my screen in a moment or two. Thank you for having me. I can't believe there are nearly 600 people who want to do this of an evening. I presume they came to hear Michael West, but they've inadvertently stayed. So I'm delighted that you've stayed for this, and I also recognise some names, both on my own phone with people sending me cheeky messages about being rubbish, and some in the questions I recognise. So I think we've got the Republic of Ireland represented by one of their senior nurses. We've also got some very important dentists in the crowd, and I imagine we have the whole gamut of the Royal College's members and fellows. I hope there are some travel medicine people in there somewhere, and I know for sure there are some dentists, the backbone of the Royal Colleges of this country, I would suggest, clearly, but maybe I'm a little biased. So I'm going to do two things. I'm going to talk about where we are, both globally and nationally, in the pandemic. I hope you don't mind me manipulating the title a little. And then I'm going to give just a little bit of insight into what I think are some of the key leadership behaviours that can perhaps guide us both through this phase, but also into whatever comes next. And I'm no Michael West. So mine is, if you want to learn the leadership behaviours, actually you should watch the Michael West bit and ask Michael the questions. But I'll try and give some insight that might lend itself to some of that. But let's for a moment think about how we got to here. So this is Tedros, Director General of the WHO, and when the music stopped, he was in the most important seat in the world. He's a former Ethiopian health minister, fortunately, one of the best public health thinkers in the world, and I'm glad he's there. The WHO is known for its bureaucracy and slowness, and I think during this crisis has played an absolute blinder. Not universally accepted view, but I think they've done very well. 194 countries that they've had to provide guidance for. Imagine trying to do that for simple things like testing or face coverings, or how you should treat people in intensive care for Estonia and Ethiopia and England all at the same time. One of the things they do is they decide when something is a global public health emergency. They have a committee that does that. They've done it 6 times in the modern era. And let's just go to 2014 as a neat example. Ebola, 28,500 people, almost all in West Africa, 11,500 die. It's a horrible disease. And they ring the bell for the global public health emergency. We all wake up, we all do our thing, and we brush off the pandemic plans from the wall, and nothing happens. We get one case in Scotland. She survives. She's beautifully treated. Then fast forward to the end of 2019. It's Hogmanay. Not a Hogmanay we'll forget in a hurry, and they declare a global public health emergency for SARS-CoV-19, a virus that doesn't even have a name at that time. It's now, this is a couple of days out of date, it's now infected 111 million people and killed 2.5 million. Nobody alive today has lived through anything even remotely like this. We have no reference points for this. People will talk for the rest of our lives about the pandemic, about during and after. And that's what our leadership hopefully can help us to get through. So this is the challenge. It's not just a health problem. This is a European capital. It happens to be Edinburgh. This is what it looks like before coronavirus. This is what it looks like after coronavirus. This is the first week in April 2020. And I can tell you, it looks pretty much like that tonight. This should be a thriving metropolis, not far from the Royal Colleges of Edinburgh, the B team Royal Colleges, clearly. But you can see what we've done to society. And I'll illustrate that in a moment or two with some data that might illustrate it better than the image. This is where Scotland is just now. This is the 7-day incidence rate from the beginning of September to yesterday. And we are coming down, but we're coming down slowly. And we're coming down slowly because of this. This is the whole pandemic, 2 waves. Every colour is a different genetic version of the virus. And you can see wave 1, hundreds of versions of the virus. We eliminate the virus in the summer, pretty much. And then we re-import it from the rest of the UK and internationally. We, of course, re-export it to the rest of the UK and the rest of the world. It goes both ways. The virus doesn't care in which direction it's travelling. It travels from high prevalence to low prevalence. The big pink band in the second wave is the Spanish variant of the virus. And the smart ones amongst you will have realised that the green band is the new Kent variant. And that Kent variant does this. So forget the blue line. We're going to do this quickly, so stay with me. Forget the blue line. That's when we don't know what variant it is. The red line is old variant virus in Scotland. So it did what we expected it to do. Lockdown on January the 4th, 6 weeks later, get to almost zero. That's what happened in March, April and May of 2020. We now know how to do that. We can then recover, reopen society, build vaccination. We're out the woods. Unfortunately, first week in December, the virus decided to mutate beyond us. It got more transmissible. That's the green line. You can see it rising exponentially. Tail end of December, we have a Christmas mixing of a variety of types across the four nations. And then we lock down on January the 4th. And you can see the difference. You don't need to be an analyst to work out that the slope of that curve is perhaps different from the slope of the red curve. And that's the challenge we face today. And that's why those of you in Scotland will, I hope, have been paying attention to what is our next version of our strategic framework to try and get society out of this chaos and misery that we're all facing. Now, the problem here for leaders is that the exam question is not as straightforward as Twitter might suggest. The exam question is not how do you get rid of COVID. The question is how do you reduce harm from COVID while reducing the non-virus harms that your reaction to COVID causes. We call that in Scotland the four harms. Let me just click past there to here. We call that in Scotland the four harms. Harm number one, the direct health harm from COVID. Harm number two, the impact on health and social care, so the impact of moving dentistry from general practice into emergency centres, the waiting times, the mental health challenges, social harm, loneliness for old people, care homes, closing schools for the first time ever, economic harm, people losing their businesses, people's breweries closing down, people losing their gift shops, and people losing their jobs. So very quickly, four quick elements of those harms. So this is easy. This is harm number one. It's death from COVID. This is National Records of Scotland data. If COVID is written on your death certificate, you are in this graph, and you can see very clearly the two waves. You could argue three waves, but we're still in wave two, and that jump is new variant. Harm number two, so other health harms caused by your response to COVID, not by COVID itself. There are multiple versions of this graph, depending on what you want to look at. You could look at intensive care capacity. We went from 160 to 320. We now still have 100 people in intensive care with COVID. We only had 160 intensive care beds before this crisis began. So you cannot add 100 beds without reducing the level of care people get or the level of supervision nurses and doctors get. This is another way of looking at it. This is planned care along the bottom. So this is effectively postponed treatment. It's not gone away. It's just been delayed. The top line is emergency treatment. So this is either people not having illness, which may be true, people in their houses, not as many traffic accidents, not as many kids falling off bikes, or it's delay because people are not turning up with their chest pain or their stroke. And it is principally the second, unfortunately. 70% of cancer referrals are not made with cancer in the letter. 70% of cancer referrals are not made with cancer in the letter. So we are missing and storing up harm number two. Harm number three, social harm. So this is the number of children who have been at school in January. So even with the limited opening we've had, we're still not at 1 in 10 kids having face-to-face learning. And this is raw harm number four. This is direct unemployment. It has doubled in a year, and it will take 5 years to recover. This is a public health problem. This is not an economic problem only. It's a criminal justice problem. It's a family breakdown problem. It's a cultural issue, but it's also a raw economic harm problem. So the WHO give us 6 criteria for getting out. And these criteria are as true now as they were when they wrote them a number of months ago at the end of wave 1. We have incorporated them into our strategic framework today, and also the WHO's measures for how you should decide using the data of your prevalence, your hospitals, your ICUs, your deaths, about when you should make those choices and when you should come out. So, is that how you feel? Is it just a bit too hard? That's how I feel pretty much every day. When the music stopped, I was in this seat and I had no idea that this would be the seat I was going to be in. And it does feel incredibly difficult. So let me finish just with a few minutes of where I think our behaviours can get us to. So this is an IHI framework, the Institute for Healthcare Improvement, where I had the privilege of working for some time in the mid-2000s. And this is their leadership behaviours. I think they are as applicable in the COVID world as they are in any other world, but I've had to change their implementation. This is them very quickly. Person-centred care, frontline engagement, relentless focus, transparency, and boundarylessness. Not a frame through which to do governance or through which to do the way you design your system, actual individual behaviour. So no matter what level of leader you are, this is what success looks like. And they did a big study, and you can look at it. We don't have time to go into the detail about why these 5 won. So my person-centeredness is now slightly different. I have spent a huge amount of time with stakeholder groups. All of these and many others. I spent some of today doing a live Q&A with Scottish autism and autistic people asking me questions about vaccination, about care, about how they will get back to work, about whatever it applies to them. And I've done the same for each other group. So going to where the work is, whatever that might be for you. Number 2, frontline engagement. Again, going to the work, but my front line has changed. My front line has now become, what should ScotRail do about distancing on the train system? How should the bus companies work? What should we do about soft play? What should we do about nail salons? I have lists of places I've been now that I never thought existed previously, never mind places I thought I would be. But if I'm going to give public health advice to the cabinet of the country, then I should understand what it is to run a brewery and try and understand what it means to run a wedding shop or whatever it is that we've happened to close. Never mind the pieces of the health service that we have to now try and remobilize. The third is what Michael called persistence and what IHI call relentless focus. And I apologize for being on your TV all the time and being on the radio all the time, but for communication to work in a public health crisis, it has to be relentless. It doesn't always have to be me, and that's the annoying bit, I understand. But if you're going to talk to Orkney and you want Orkney to do something, you have to be on Radio Orkney at 6 o'clock. I didn't know that before this crisis. I thought they listened to the same radio and read the same newspaper as me. It turns out that's not the case. If you want to talk to Oban on the west coast of Scotland, you have to be in the Oban Times. It's a weekly newspaper that everybody in Oban reads. So you need to be relentless in whatever it is you're doing. That might be safety ward rounds. It might be redesigning dentistry, or it might be communicating with the public around a pandemic. Transparency, the fourth behaviour, you can't have missed it. I presume you're not watching anymore, except my mum, but daily press conferences or daily updates in some form, most days, about, and I'll be there tomorrow again with the First Minister of the country to speak to the public about what the data is, what the data means, and what we think the implications for that are. And then boundarylessness, my final behaviour. And boundarylessness is a lecture all of its own, but fundamentally it's about the fact that you cannot fix COVID in the health system. And what you do in the health system, of course, affects criminal justice, it affects social care, it affects every other element of society. I've had to cancel jury trials. I've had to give public health advice that has stopped lower league football, that stopped Narcotics Anonymous classes. So you cannot do that without engaging with the third sector, without engaging with local authorities and trying to come to a plan on the way out now where there are no boundaries to those conversations, because the public don't understand the difference between those two things. This is all of that on a single slide, and we don't have time to discuss it in any detail, but this is a driver diagram. Those of you who are into improvement science will be pleased, I hope, that I haven't let that world completely disappear. Tedros sums it up better than me, and just let me finish with his message to the world. And I think it's an appropriate message for coming out of this phase of our pandemic.
Many thanks, Jason. That was fantastic, and I think that those common themes of compassion and kindness are really important ones for us to take home and to take with us every day in our working lives. Now we have got a few minutes. I know you have another engagement you have to get to, but time for a couple of questions. If we could,
yes, of course,
you to that, and Michael. So, Paul, if we could bring Michael back in as well, that would be great for a few more moments. Thanks. So, some really thought-provoking questions here. One person reflecting on the fact that they're working in a place where actually things are going pretty well, but they're aware of colleagues working in settings where things are much more challenging. And the question is, how do we act in safe and positive ways to make change in place where good is not the norm, where there's fear to speak up and address poor performance? So, Jason, do you want to answer that first, and then I'll hand that over to Mike?
I was hoping that was a Michael West question. It sounds like a Michael West question to me, but the way I act in that kind of environment is, of course, to get frustrated, and of course to try and find a way through other people and argue with the people above me and argue with the people below me. The reality is, all you can do is fix the bit you can fix. I'm not a huge Stephen Covey fan, but Stephen Covey talks about a circle of influence and a circle of concern. And the circle of influence is the bit you can do. The circle of concern is the bit you care about. So I care about Syrian refugees. There's not a whole lot I can probably do other than maybe give money for Syrian refugees. So my circle of influence is the bit I need to concentrate on. And that's about my behaviors, it's about my example, it's about my values, it's about my work ethic, and it's about looking after me, my family, etc., etc. So that's how I try and do that. And I'm not perfect at it. I still get frustrated by bosses and frustrated by people who work for me. So it's not that I've fixed it, but that's my framing for trying to find my way through it.
Thanks, Jason. Michael?
Yeah,
fear to speak up, I think, is an issue, that comes through repeatedly.
Yeah. So I think Jason's point is hugely important. The one thing we can all do is listen, understand, empathize, and help in our interactions with everybody. And the emotional ripples contagiously spread out, if you like, and that is our circle of influence. I think also we need to be increasingly monitoring the health of our teams wherever they are in the system. We do a lot of monitoring at organizational level. We need to monitor the health of teams and departments. There are places in the country, Lothian does it, Northumbria does it, Wrightington, Wigan and Lee do it, where they have pulse surveys every 6 or 8 weeks to pick up hotspots in the organization so they can go in and support and help. And it's not usually about bad people behaving badly. It's usually people working in really difficult conditions, which causes people to be cross, to be angry, to stop listening or whatever. So I think also it is about the persistence. Project LIFT is a really important project in developing compassionate and collective leadership across public services in Scotland. And that's being really effective, but it's taking time, as all of these culture change programs do, to roll out. But we must have the courage to be persistent and to provide the supports to enable that. And the 4 UK countries and Ireland are working together now at policy level to help to develop that kind of leadership across all 5 countries. And I'm really optimistic about the future.
Thanks, Michael. I'm just trying to find one other question from earlier that I think would be really interesting, and that it was very much along the lines of as we think about restoring services, what do you think restoration for the workforce should look like? And there's a lot of discussion about this in various fora that I am involved in at the moment. So what would good look like for our workforce? But Jason, I know you're pushed for time. If you need to leave us, please don't.
No, I'm fine. I'm fine until 15:15, Jackie. And it's only a pre-record for the 9 on the BBC's, which nobody watches. So it's no, I'm joking. I'm joking. They would hate me saying that.
Well, Michael, let's give you that one first.
I think this is a really important question. I was talking to an E consultant about 3 weeks ago, and she said, we got through the first wave and we had a message from the chief executive who thanked us really warmly and profusely for all we'd done, and then said, now we've got to get back to business. And she said her colleagues were just flabbergasted. And there is a sense that, you know, the sponge has been taking on water. People have been working so hard, and you can't go on taking in more water when you've accumulated so much weariness. And I think we do have to begin a consultation with staff. It's not all staff. There are some groups that have not been under as much pressure, although we've all suffered from the fear and anxiety and some real tragedy during this. But we have to consult with staff about the rest that they're going to need. And I think we have to do a lot more about educating people about how we recover from daily work stress. There's a broad literature on recovery that we should be drawing on that tells us about the importance of activities at the end of working days to do with psychological detachment from work, what takes us away from it, so we engage in activities that give us a sense of mastery, like cooking or sports or music, where we relax. We know about the importance of increasing work breaks during the day for people, that every hour or two people should have a break, should be able to have a chat and a rest, that, you know, Helen Stokes-Lampard is on vacation. We know those are important, but the effects only last a couple of weeks. It's about physical exercise. It's about spending time in nature as well. And we know that there's a hierarchy of benefits. Blue spaces, lochs, rivers, the sea are the best. Green spaces quickly follow, hills and forest, and then urban parks, and then finally urban environments. Being outside with diversity of architecture is better than being in high-rise building areas. And also that, and this is a lovely finding, you know, the more time we spend in areas where there's greater biodiversity, the better it is for our mental health. And the importance also, you know, above all, of spending good quality time with the people who love us and who we love is vital for our health and well-being. The important nettle to grasp is a recognition that there's an inverse recovery law. The people who most need to recover are the ones who are least likely to do all of these things. And I think we do need to begin a conversation addressing the issue of how we enable staff to rest before we ask them to then take on the big task of picking up the backlog. And that's a really serious and difficult conversation, but we have to start having it, I think.
Yeah, thanks. I couldn't agree more. Jason.
Well, I've discovered what my problem is, because I've tried the cooking and the sports thing, and I have no mastery for either of them. What I have to do is find something that I have mastery of, Michael, and I'm struggling to find it. But so I have
get your nails done now that you know about it.
Now I know about nail salons. I can tell you a lot about the mitigation in a nail salon if anybody's ever interested. So Michael is of course right. That balance, that family and friends thing, that all the things were missing. I was talking to somebody today about the next phase, and they asked me for a verb about what we needed to do about the next phase, and I said breathe, and I meant a kind of, oh boy, because I'm going to be a little bit controversial here, particularly in this crowd. This is not a health service problem. This is a problem everywhere. This is a criminal justice problem. It's a politician problem. I mean, some of the leaders of the nations have been going at 100 miles an hour for 14 months. And they're human just like everybody else is human. So have the opposition leaders. It's not just an in power thing. And we need to be mindful. I know people won't want to be mindful of their well-being, but we do, as well as the invisible layers of civil servants. Some of the civil servants in Scotland have worked 7 days for as long as I can remember now in order to deliver what is a vaccination programme at scale that is, of course, staffed by health and social care workers, but it needs procurement people, it needs civil servants to manage that. So it's a much broader problem than a health and social care problem. And we should be part of the solution for that, because we should set an example, but we should also be part of the care and the pastoral help to those other sectors of society. And Michael's right, that conversation has to happen, and it has to happen now.
Thanks, Jason. And Michael, well, I'm mindful of the time. We have run slightly over, but I'm sure you will agree that it has been worth it to allow that discussion. Thanks to both of you, and of course to Helen, for really, truly wonderful, uplifting talks, I think I would say, and things that we've all learned from. And I guess I feel if we really can embed these important leadership principles into healthcare, then I think we've got a great opportunity to see not just recovery of healthcare services, but recovery of the workforce that's so desperately needed at the moment as well. So I think at this point we should stop and allow you all to achieve mastery, either of your exercise, your cookery, your sports, or just be with your family and rest. Can I again thank our fantastic speakers. Thank you for joining us as delegates. Please give us your feedback. We'll be sending you a link for feedback. And I'd like to let you know that our next webinar will be on the 23rd of March and is going to be, let me get the title right, is going to be about organ and tissue donation, the new opt-out system. So thanks very much, everyone, for attending. Thanks to the IT team in the background for working hard, and enjoy the rest of your evening. Thanks.